when you think about measurement-based care, if the current way we're looking at measurement or the past way we're looking at measurement is a reporting exercise, measurement-based care flips that on its head and makes it first and foremost about clinical value. Without providing value to the client and without providing value to the clinician, it doesn't work. And without making it a process that's about clinical value that is circular, that you collect data, you share the data, and then you act on the data, the power of measurement-based care isn't really unleashed. So that process part is fundamental. In research, what you're seeing is that the more assessments a client completes, the better that they do in care. And on top of that, the more times that a clinician views the results of their clients, the better that client will do. And the assumption there is that they're then using that in the care process, and that's likely why they're seeing more improvement. So if we could provide a one-stop shop digital front door, where regardless of what resources people are accessing, they have the ability to track their own mental health, and we can somehow try to replicate, not the clinician from a therapeutic perspective, but the role the clinician plays in helping someone be curious about their own data, where we really help people understand their mental health and be better at guiding themselves to the right resources, as well as recognizing when they need support. Making sure everyone knows exactly where they can go to one place where they can access all care and they can find the care that they think is right for them versus going to one place like in-person counseling because they don't know where else to go and they know that they're going to get support there. So if someone knows what options are available, understands their own mental health better, they're in a much better position to be active participants in their care process and choose the right care for them versus the care that they know about. And the third piece is user-reported outcomes for innovation and improvement. And that's a piece that we've heard from many organizations not having great data on usage and especially on outcomes of resources outside of a clinical setting. And so understanding what resources are working, what resources are not working, which are people accessing, and using that information to inform strategy moving forward, and also understanding gaps. So you may learn that people with moderate depression are not finding a resource that's actually helping them. So you have an understanding of where to focus your time.